Knowing how to take a pulse could potentially save someone's life. Mayo Clinic says your pulse is your heart rate or the number of times your heart beats in 1 minute. I have worked several months to earn my Certified Nursing Assistant Certificate, or CNA. In March of 2021, I completed my course and passed my in-person evaluation. One of my questions was how to take a pulse. I had to show my instructor that I knew how to. Knowing how to take a pulse is a good life skill to have. It can help someone in need, and it is just fun to practice on yourself. Taking a pulse can be done with 3 simple steps: locating, feeling, and counting. First, let's talk about locating the pulse. There are many places to find a pulse. The best place to take your pulse is at your wrist, your elbow, or the side of your neck, or on top of your foot, according to the American Heart Association. I find the easiest place to take a pulse is the radial pulse or your wrist. To locate the radial pulse, put your palm face up. Next, put your index finger and your middle finger together, like this. Lastly, place them on the thumb side of your wrist, so like this. Now that I have told you about locating the pulse, let's discuss feeling the pulse. It takes practice to feel a pulse. Everyone is different, so you might not find the pulse right away. Don't get discouraged. I didn't get it on my first try, and you probably won't either. With your index finger and your middle finger, you want to press firmly. If you don't press firmly, you might not feel the pulse. You should start to feel a heartbeat. If you don't feel your heartbeat, you can adjust where your fingers are located. Your pulse might be higher or lower on your wrist. A normal heartbeat should be steady. A non-normal heartbeat is jumpy and has lots of arrhythmias. Having an arrhythmia can lead to many things, such as increased risk of blood clots, which then can lead to heart attacks. Now that I told you about feeling the pulse, I will discuss counting the pulse. Having a clock nearby is helpful when taking a pulse. To take an accurate one, you need to be sitting down. Also, you want to make sure you didn't just do any physical activities because that will increase your heart rate. You want to find a clock with the second hands on it. Next, you want to remember when you started counting. To count, you just count the number of beats you feel. The normal number of beats per minute is 60 to 100. In the medical world, you are supposed to count for 1 full minute. You don't have to count for 1 full minute. You can count for 30 seconds and then take the number you got and multiply it by 2. If you get any higher than 100 when you were doing the pulse accurately, you should consider seeing a doctor. Having an abnormally fast pulse can mean many things, such as a virus that can be causing your heart to be weakened, and so it has to pump blood faster than normal. A skill to saving someone's life is as easy as 3 simple steps. I challenge you to practice on yourself in a normal situation and a high-stress situation, and compare the difference. Remember the 3 tips I gave you: location, feeling, and counting. So the next time you go to wake someone up and to see if they are even still alive, because they won't answer you, just take their pulse.